with my dear friend Kathy Colby, long time friend. I'm not going to say how long because I don't want it to date either one of us, but it's implausibly long. Uh, we're going to be talking about an entire surgery in which you've been the spirit and continue to be, and that is primary Descemet stripping, and if you don't mind, I'd like you to just very briefly recap what it is, and then the exciting role that ROC inhibitors play as an adjunct.
Great. Hi, Josh. It's always fun to be here with you. It's been a great academy meeting. There's a lot of interest in Descemet stripping, which is basically a very simple technique where for Fuchs dystrophy patients with central corneal goutte, where we simply remove the goutte, allowing the healthier peripheral endothelial cells to migrate, repopulate the central cornea, and detortuous the cornea.
And the salient word in that entire disquisition was migrate. So, what role does ROC have with migration?
So, yeah, about 3 years ago, right around the time of the meeting in October of 2016, Greg Maloney's colleague in Australia emailed me very excitedly that he had been able to rescue 2 Descemet stripping only patients who were not clearing with a topical ROC inhibitor, Reposidil. And the Reposidil actually has effects on the cytoskeleton. Exactly how it facilitates migration, I'm not sure that we know, but the addition of the ROC inhibitor to the Descemet stripping appears to make it heal more quickly, increase the final cell count, and improve the success rate overall.
So, increase the final cell count, meaning the central endothelial cell count. It's not that it's causing. Well, no. Let me say this in the form of a question. Is it causing an increase in the overall population of endothelial cells?
So we don't know the answer to that. And so why don't we know the answer? Because there's only one center of the cornea where there's 360 degrees of periphery. So it's very hard to image the same area of the peripheral endothelium and make sure you're in the same exact area every time. Interesting work from Marian Maxey in Chicago showed that when she did a randomized clinical trial and used topical Reposidil, that the peripheral endothelial cell counts did not decrease, whereas they did when she just did Descemet stripping without the ROC inhibitor. So that would kind of argue that potentially there is some cell division, but we don't really know.
So, and just for people who've not heard of it, the Reposidil is a BID Japanese medication?
Yes, it's approved in Japan for use for glaucoma, and it is given twice daily for glaucoma.
So, tell me, tell me where things have gone from there with respect to ROC and the number of patients that have been done and all that sort of stuff.
So it's really been fun to watch. Sometimes when you put out a novel idea, novel technique, there's some initial skepticism.
Oh, wasn't the case with yours? I mean, people just cheered from the start, right?
No,
You had no pushback at all.
No. So there were skeptics, understandably. I mean, I think there were skeptics when Garrett Millis started 15, 20 years ago, introducing various forms of EK. But over the years, the data actually stand for themselves. And really, to date, at this meeting, either published or presented, we're now up to 230 cases of Descemet stripping supplemented with topical Reposidil. And the results are quite good. From some of the most recent data, failure rates of 6 or 7%. And it does appear like the central endothelial cell count is higher with Reposidil.
Now, responses of the patients to this surgery and to cornea surgeries generally is, pretty protean and it's a pretty wide spectrum. How do you, are there any sort of head-to-head trials with patients receiving ROC or not to decide whether it should be mainline adjunct therapy for this surgery?
Well, so the MAXI study that I mentioned was published in Cornea. I believe it was earlier this year, and that was a small investigator-initiated study. I think of a dozen patients in each arm, but it was randomized, unmasked, and it did show quicker recovery and a higher final central cell count. But we're really to prove that something works, you have to generate level 1 evidence. So we're actually in the process of doing a placebo-controlled, randomized, multi-center, masked trial sponsored by COA, who is the manufacturer of Repositil.
So I wanted to ask you that too. So this is a medication that's not available in the U.S. Is that right?
It's not FDA approved in the United States, but we live in the wonderful world of the internet, and patients can get it online.
Okay, well, I mean that's now one question that some people I'm sure are going to want to ask is there is an FDA approved QD ROCK inhibitor in the U.S. Is that substitutable for this? Do we know that?
I have no personal experience with Notarsadil, which is the one that's approved in the United States for glaucoma. We're early on in our experience in corneal endothelial dysfunction with ROCK inhibition, and there's various forms of the Rho kinase, and so the pharmacokinetics of Repositil and Notarsadil are not identical. So the answer is, I don't know the answer to that, and I have no personal experience. I do imagine that there are people in the United States trying Notarsadil because it is approved in the U.S., and we do use it at a higher dose. So Repositil is approved in Japan for BID, and generally people are giving it QID for endothelial rejuvenation.
Really interesting. Just one last really basic question, then I promise I will let you out of this room, which is in the event that DSO fails, that Descemet stripping fails, does it preclude a subsequent endothelial graft?
It doesn't, and we published that in 2017. My colleague Peter Veldman was the senior author. It was published in Cornea. The 3 people in our original series failed to clear and had uneventful DMAC. And then in my most recent cases, we've had a handful, and they also have uneventful DMAC. So it doesn't really preclude a successful endothelial keratoplasty, and basically what you're left with is a couple of months of corneal edema if it doesn't work.
Yeah, if it doesn't work.
Yeah.
This is wonderful stuff. Kathy, I'm always happy that you choose to share this with me, and because it's interesting. It's really neat, and it's really moving the needle, as the cool kids say. I want to thank you chiefly for being so very generous with your time with us today.
Well, maybe I can ask you to put a plug in for the upcoming World Cornea Congress, which is in Boston next year. It's the premier cornea meeting. It only happens once every 5 years. It'll be in Boston in May. It's a nice time to visit Boston.
Yeah, I am very much looking forward to it, and our connection stems from Boston.
Yes.
Wonderful. Thank you very much.
Thank you. Oh, my pleasure.